morning. My name is Hannah Pasternak, and I'm a licensed clinical social worker, and I work with Lisa Eaton Therapy and Coaching. And today I just wanted to hop on here and tell you a little bit about my experience that I bring to the table and the type of clients that I like to work with and feel very successful with. Um, my experience started way back when I started working as a grief support group facilitator for children under 18 and facilitated grief counseling there. When I was in my master's program, I did my internship at a domestic violence and human trafficking service provider and also at a medical chemical dependency or substance use treatment program that treated both substance use disorders and mental health disorders as well. So within both of those, I had a lot of hands-on experience working with a whole range of people experiencing trauma, abuse, unhealthy relationships, codependency, generational trauma, substance use, varying mental health disorders, and lots of trauma. In my professional career, once I graduated, I continued working with domestic violence survivors and human trafficking survivors, as well as kids there as well. So I worked with about 4 and up while I was there. I still work with adolescents very successfully. Usually I see about 12 and up, a lot of times working on school issues, bullying, healthy relationships, ADHD focus, depression, anxiety. I also still utilize a trauma-informed framework, and so I work with a lot of people experiencing trauma of all different ways, and it manifests in different ways for them, as well as a whole variety of mental health disorders, including bipolar disorder, ADHD, borderline personality disorder, anxiety, depression, PTSD. I work really successfully with men as well. I have a very directive style, and so I find that that just works really well for a lot of the people that I work with. And I also facilitated a handful of psychoeducation groups, which is basically education about the way that certain experiences impact our mental health, from art therapy to a PTSD processing group. I ran a human trafficking group, a personal empowerment program, substance use process group, DBT skills group, mindfulness, meditation, things like that. So I pull from all of these experiences and really apply it into our therapy space together. If any of what I shared with you today feels like it really resonated and you feel like you can really identify with that, I'm currently accepting new clients, and I see adolescents from 12 and up all the way into late adulthood, and work with really motivated people to make the progress that they really want. So if any of this resonated with you, feel free to reach out to our intake coordinator and we can get you set up for a free 20-minute consultation. Thanks. Have a good one. Bye.